Hi, I'm Andrea Thomas. I'm a speech therapist at the Recovery Project.
And I'm Kayla Diebold. I'm a physical therapist at the Recovery Project.
We are coming to you live for our first Facebook Live session for an actually really important topic. And it's timely too because it's Stroke Awareness Month. So what we want you guys to do, if you can, so this can reach a ton more people, is to share on your page so other people can watch it as well. So we're going to talk about what strokes are, why it's important to get help right away, what those first symptoms are that you might see that give you, a sign that a stroke is going, and then also talk about the long-term effects of a stroke and then what we have to offer at the Recovery Project. So thanks for joining us. Kayla's going to start with talking about what a stroke is.
Yeah, and if you have any questions throughout the talk, feel free to type them in and Kai will let us know and we can answer as we go. So I'm just going to talk a little bit about what a stroke is. A stroke is also known as a cerebrovascular accident, so you might hear that, or CVA. There's a couple terms that can describe a stroke, but what it is, it's just, it occurs in the brain and it's a disruption in the blood flow or the oxygenation of the brain. So you can have two types. There's a stroke where you have a hemorrhagic stroke where there's too much blood vessel bursts and there's too much blood flow and nothing's actually getting perfused, so it kind of cells. And then you could have a ischemic stroke is the other type of stroke where you're not getting enough blood to the brain, and so both of those can affect the brain and limit its function and communication with the rest of your body. So I just want to review, since it is Stroke Awareness Month, what the signs of a stroke are, so that if you see it in someone or in yourself, you can get help right away. Because the sooner you get to the hospital and get the necessary medical attention, the better outcomes there are after a stroke. So the acronym that is good to remember is B FAST. So B stands for balance. So if you have a sudden change in your balance or coordination, E is, I don't remember what E is.
I just learned that
it's your eyes. It's your eyes. I'm sorry. It's your eyes. It's your vision. Or any visual changes, double vision, something changing with your eyes, is your eye drifting to the side. F is your face. So if someone is smiling and it's asymmetrical, that's also a sign. A is arms. So you ask someone to lift their arms up and one arm goes up higher than the other. S is speech. Is your speech slurred or incoherent? And T is time. If you have any combination of those signs and symptoms, it's time to call 911 and get to a hospital to get the help that you need.
Yeah, I think I even read a statistic somewhere that said the longer you go, so every minute that you go without getting treatment while you're having a stroke, it can kill over 1 million brain cells.
Yeah.
So it's really, really important to get help as soon as possible. So if you've had a stroke, some long-term effects of a stroke can cause balance and gait issues, so difficulties walking, difficulties with upper body strength and moving your arms, difficulties with speech, so slurring or difficulties finding the words, and then, we talked about eyes, so visual neglect, so not being able to perceive things on the left or right side of your body. And then difficulty with understanding and expressing language and communication. So do you want to start talking about what physical therapy has to offer as far as
Definitely.
treatments at the Recovery Project?
Yeah, so physical therapy in general after a stroke focuses on just restoring whatever function we can for your balance, your walking, getting back to the activities that you did beforehand. And so with all rehab with stroke, you want it to be very specific, task specific to what your problem is, and you want to do a lot of repetitions. So here at the Recovery Project, we have a lot of specialized equipment that you can use to do that. So we have what's called a light gate, and it's a harness system that goes over a treadmill and it supports you as you're walking so that we can work on getting a lot of steps in an hour, and it allows us as your therapist to fine-tune your walking, whether you're not able to pick your foot up high enough or you're not taking a long enough step, you're not weight shifting enough. So that's a great piece of equipment we have. And then we also use functional electrical stimulation, or FES, a lot with our stroke clients, and we can use it in a bike. It's called the RT300, which helps simulate that gait pattern, that cycling, that pushing, alternating between the flexion and extension. And then we also have another piece of equipment called the Excite, where we use electricity to turn on your muscles to practice more functional tasks, like going from sitting to standing, or just standing supported, weight shifting, stepping up on a step, all those sorts of things.
Good. Okay, and then for speech therapy, so a common symptom that individuals who've had a stroke experience is something called aphasia, which is, kind of like a loss of your understanding of language, and then difficulty expressing yourself as well. And this can, go beyond just speech, but it goes into reading and writing as well. So we know evidence-based treatments to treat aphasia. We also treat swallowing, which is kind of surprising to people since my title is a speech pathologist. But we treat swallowing disorders, and we actually have a really cool device or a cool technology called VitalStim, which is pretty much neuromuscular electrical stimulation on your throat area. And so what it does is it contracts your throat muscles to help initiate a swallow. So it's kind of like a bonus to traditional swallow therapy. We've seen a lot of good results with that. So we treat aphasia, swallowing disorders, and then also just overall speech disorders, so things like slurring or stuttering. And then also we have occupational therapy, and they work more on the upper body type deficits. And they have a really cool device called MyoPro, which is really cool looking. A technology that you put on your arm. It's like a brace, and it's powered, and so it helps you move your arm better. Can you help me describe it a little more?
So it's a device that goes over your arm, like Andrea said, and then it has sensors to see what muscle activity is going on in your arm. So even if you just have a little bit of muscle contraction, where without the device you can't lift your arm or bend your elbow, it can detect that your muscles are trying to work and complete that movement for you. So you can use it for feeding and different activities. I've seen some of the occupational therapists use it for grasping. So it's just a really cool new piece of equipment. And our OTs spend a lot of time on that task-specific, high repetition activities as well, like we were talking about earlier.
Yeah, they also focus a lot on activities of daily living. So things like dressing, cooking, doing things around the house that maybe was once easy for you but now more difficult after the stroke. So we have a lot to offer here. We also have a new stroke exercise program coming. Do you want to talk more about that?
Yeah, so starting in June 10th, we're going to have a new exercise group class starting here. It's called Stroke to Strength, and it's going to be twice a week for 8 weeks, and it's going to be great because it's going to be a group class where everyone there has had a stroke, and so it'll help build that community and kind of a mini support group. But then it is instructed by trainers who have been trained by the therapists here on specific exercises and activities that are really important for people with a stroke to continue working on. And we're going to have homework given out to work on the cognitive piece and just kind of hit all aspects of stroke, and keeping you moving and healthy and staying active, which is most important after a stroke, is to continue moving.
Did you say when it's starting?
June 10th. And so I'll give you the phone number right now. If that's something you're interested in, you can always call in and set up a screening. We want to just make sure people are appropriate for the class before they show up the first day. So our phone number is 734-953-1745. And if you have questions and the live is over and you want to call in for questions, you can call in at that time too. But it looks like Kai's got some questions.
I just want to say one more thing first. If you guys want to see like the MyoPro that we talked about, and I think there's stuff on VitalStim too, you can check out our Instagram. Pretty sure it's the Recovery Project. Is that the name of our Instagram, Kai?
Yes.
The Recovery, it's the Recovery Project. We also have stuff on our Facebook page too, so check it out. It's really cool. All right, question.
Okay, so one of the questions is, one of my family members recently suffered a stroke. What is some advice you have to show support without being overbearing?
That's a good question. So I think that there's a common misconception about stroke that there's a critical period at the beginning. There is. There's a period where you make a lot of progress, but then people tend to think that that's it. So to encourage your family member, I would let them know that it's okay to be frustrated, but the recovery is a lifelong process. And so there's no end to the progress as long as you keep working towards it and have specific goals.
I think it's important too to try and empower the person who has had a stroke and offer assistance, but maybe let them ask for it when they need it, to allow them to try and do as much as they can and be as independent as possible.
Another question is, I've heard that to have recovery of movement after a stroke, the number of reps are important. Is this true? And if so, how many?
It is true. You want to get in as many repetitions as possible, because if you just do, say, like 3 times trying to bring your arm up to take a drink, that's not realistic in trying to recover and learn something that you learned throughout a lifetime. There's a bunch of different research talking about what's that critical point, and I think there's not a magic number of 100 repetitions, but we want to try and maximize your time, and that's where therapy is very helpful, because we can practice those same activities and things that you're trying to get back your ADLs, your walking, your balance, and do activities to get those high reps in different ways.
And what are ADLs?
Activities of daily living.
Okay.
So like bathing and dressing and eating.
Good question.
Thank you. So another question is, what is a typical therapy session look like?
I think this looks
PT
different. So for PT, it depends on your deficits, obviously, but we try to incorporate endurance activities to build up how long you can walk for. We want to work on strengthening, and we also we want to work on balance. So I just finished up with someone this morning who had a stroke about 2 months ago, and so her session looked like we got her on the light gate, which is that treadmill with the harness system, and we walked for 5 minutes at a time and took a break. Sometimes it's more or less depending on the person, and we did that for about the first half of the session, and then for the second half we worked on specific balance activities. She has a really hard time with going up and down stairs without assistance, and so we're working on improving her ability to stand on one leg and lift the other leg. So we did a bunch of different exercises to work on that. You can talk about speech a little bit.
For speech therapy, it's going to be typically in a one-to-one setting, so we'll usually be working in a private office together. And so depending on whether we're working on swallowing or language or speech, the treatment sessions would look very, very different, but it is highly individualized based on the client's needs. So all of our treatment plans are discussed with the clients, and it's mutual goals. So goals that the client wants to address and achieve. And so it's really hard to say what a typical session looks like, because they're not all the same. I mean, every person we have that's had a stroke, I mean, they all have something different. So I would say it's very specialized, but you do get a very one-to-one individualized attention at the Recovery Project.
And that goes across all 3 disciplines. We are always working towards our goals, as long as they kind of align with what we do as a profession.
Yeah.
Okay.
Good questions.
There are quite a few more. Okay, so do you have any tips or recommendations for a young person who is 2 years post-stroke and works full-time that wants to continue living a normal, active life? Specifically, what can a person do to stay motivated with their home exercise program despite being exhausted?
That's a great question. I think for anybody, how do you stay motivated to stay active and stay fit? Even though you do work full-time and you have other things in your life. I think for someone who has had a stroke, it's important to remember that your brain is a powerful thing, and it can make changes throughout your lifetime. So just because you're further out from your stroke doesn't mean that you can't make improvements. There's still a lot to say for those high repetitions, making sure that you're focused on your exercises and your fitness. So if you have a goal and you want to run a 5K, then working on your running endurance, what specific things are missing, and how does your running maybe look different than someone who hasn't had a stroke, and then working with a therapy team to fine-tune those things. And similar for like occupational therapy, if it's more like your arm function, they have tools that they can offer to help fine-tune what you're already doing. And I think just going in for those tune-ups after you've done your initial therapy is always recommended, because throughout your life you're going to come up with new challenges that you face, or different health changes that may affect your mobility.
Okay. So how are post-stroke swallowing problems assessed, and how is the progress measured?
Okay, that's a really good question. So typically when somebody comes to me, I like them to already have something called a modified barium swallow test that's done in a hospital setting. And it just gives me, like for example, if I was watching Kayla eat, she coughs, I know that there's something wrong, but I don't know what's wrong, okay? Because I can't see the musculature, I can't see, what's going on. If her tongue strength is off, what? So what the modified barium swallow test shows me is, what musculature to target. And so based on that, we'd form a treatment plan. And then, Kai, can you repeat what the question was exactly?
The question was, sorry, kind of moved from that.
She lost it.
How is the progress measured, and how are post-stroke swallowing problems assessed?
Okay, so the assessment portion I covered. So somebody will come to me for an assessment, and if they don't have the modified barium swallow study, I'll usually refer them out to get that, just so that I can get more information. Then that helps me formulate a treatment plan based on what's happening. And then the progress is measured based on if your problems are going away. So if the coughing is lessening, if you're not getting sick from eating. And then also we'll do a repeat modified barium swallow test to see if the initial problem with the musculature has subsided.
Okay. So I can't see the other questions. So can you ask them to share again the video?
Okay, and just one more time, make sure that you share the video so that we can reach as many people as possible. Again, strokes are, I think, the 5th leading cause of death in the United States, so it's really important that people have heard, the acronym FAST, or BFAST, which I learned the B today. I had no idea.
Yeah, and if you have other questions after this, feel free to call. The phone number again is 734-953-1745. And thanks for spending some time with us.
Follow us on Instagram.
And what's that?
The Recovery Project, at The Recovery Project.
Awesome. So is there any other thing that we should know as far as being caregivers? Are there some things that we should watch for?
I have a specific thing for aphasia that I see a lot. So again, aphasia is most often difficulties with expression. So taking longer to get your words out, maybe the word doesn't come at all, or maybe it comes out like as gibberish. And one thing I see that caregivers do often, that's really frustrating to the clients that I see, is kind of fill in the blanks of what they're trying to say, rather than giving them time to come up with it on their own. I mean, I know that it hurts to see your family members struggling, but at the same time you're not doing them any justice, not giving them time to process and come up with the words on their own of what they want to say. And then also offering them some assistance in a different way. So offering them maybe like a pad of paper, can they write what they're trying to say? So just coming up with different ways to support them rather than doing things for them. So we love when caregivers come to our sessions because we can teach them these things. It's not something that just comes automatically, and we understand that, and it's absolutely something that family members or caregivers should do time to time, is come in and see like how we're interacting with the clients and what they can do at home to help.
And that stands true for physical deficits as well, trying to let the person with the stroke do for themselves first and initiate asking for help.
Okay. What kind of short-term and long-term improvements can someone expect to see from a class like this?
From the group class?
From the group classes.
So what we're hoping to see, and what has been found in the research is that participating in these group classes is not only good for you physically, but it's also good for you emotionally to have that support, knowing that there's other people like you, and being able to like see how other people deal with the same issues. So we're hoping to see people not only maintain the progress that they maybe have gotten from physical therapy, but also to improve some of their walking and balance, to be able to do those sorts of activities and using their arms and things like that that they may not feel comfortable doing at home. So it's nice that it's here at a physical therapy and occupational therapy clinic. So we work really closely with the trainers to make sure everything is done in a safe and appropriate manner. So we're hoping that everything is going to move forward. It's a new class, so we don't have any numbers to back it up, but research shows that these sorts of classes are great.
Yeah, I'm excited for it.
Okay. I know emotional personality changes are possible following a stroke. Is it possible these changes will last? What would you recommend people do to help process and manage these changes?
So emotional changes?
Emotional and personality.
Yeah, that's a really tough one. So I'm gonna speak from personal experience because I'm not sure exactly what the research says on this, but I've noticed, over time, sometimes the emotional changes will stabilize. I know that doctors often prescribe medications to help with some of the mood changes. I also think that, and again, this is from a personal standpoint, that therapy, like psychotherapy, is a very, very important factor in anything life-changing. So, think about people who actually go through this and they lose so much of their independence and, the ability to speak, the ability to walk. And so it makes sense that there's a lot of emotional changes, and I think that it doesn't make sense to just try to ignore it or work on it on your own. So I definitely think it's like a team effort. So it should be, the caregiver and the patient getting with the doctor, and the doctor and referring to a psychotherapist. I don't know if medication would be helpful or not, but I know that there's a whole team of people that make those decisions.
I've noticed too that with respect to that, as far as personality, I've had an aunt who never cursed a day of her life, and after her stroke she began to curse like a sailor. And so is that one of the things that happened from a stroke?
It's interesting you bring that up. So I will have patients that can't say any words, but those swear words are always still there. And it's because the emotion center of your brain is a different area than your language. So those words hold so much emotion to them that, they still just come out super easy. That's not the area that's damaged, it's the language portion. And those words, for whatever reason, are so closely associated with emotion that they just flow like crazy. So wow. Your aunt is not unusual.
Okay, I think that's it.
Great. Well, thank you again for joining us.
Yeah, thank you.
And follow us on Instagram at The Recovery Project.
Awesome.
Thanks, guys.
Bye.